Good afternoon, everybody. Welcome to today's President Dialogue from GAME with the question, does digital engagement of learners really work? I'm Eva Thalmann. I'm the current president of GAME. I'm very happy to introduce my expert panel, and I would like to thank all three of them already upfront for having time for GAME today and for this discussion. We have Dr. Ina Weishart. She is president and co-founder of LLH Concepts. Ina in the past also was working for the pharmaceutical industry. So you have experience, right, with the industry, being inside, outside, and from an educational expert perspective. Then I'm also very happy to welcome Dr. Maria Jose Joan Fita. Maria is medical oncologist and associate professor at the CEU Cardinal Herrera University in Valencia. And I invited Maria because Maria is an expert faculty and she was using digital media, but also face-to-face educational meetings over the last years. And I'm very interested of what a user or a implementer actually is going to tell us. And last but not least, hello to Dr. Brian McGovern. Brian is the co-founder and chief learning officer at Archemedex. Also in his former life, he had industry experience with Pfizer. So also, Brian, you know, you have the academic background, you have the industry background, and you are also connected to the Alliance. You were the host of the Alliance podcast. So welcome, Brian. So before we look into your feedback, I was thinking, let's go a step back. Let's not talk about digital and face-to-face. Let's actually look what is good or what is even impactful engagement of learners in general. And maybe, Brian, if I can start with you, what would you understand on impactful engagement?
Thank you, Eva, and I hope you can still hear me with the lawnmower directly outside my window now. I appreciate the invitation to participate, and thanks for the kind introduction. I want to set a little bit of context here because just like one snapshot. So you take 1 year and you go through all the educational publications that are out there. For example, I just pulled a year, like 1 or 2 years ago, I did this and found over 300 published articles on engagement and over 2,000 web articles on engagement. And 99.9% of them are broadly ambiguous in their definition of what engagement means. So I want to set that context. When we're doing this, we really need to understand, anytime we're talking about engagement, we really need to understand what we mean, make sure that the people we're communicating with understand what we mean. So I'll set a definition. There's a few resources I will share in a second with everybody, but basically when we talk engagement, we need to think about, number one, the cognitive curiosity and reflection of the learners. Right? And we all know, I hope we all know, that without that cognitive curiosity and reflection, there really is no learning. Number two, we need to think about the emotional or motivational state of the learner. And then number three, and I think this is what always gets conflated, is we need to think about the behavioral interactions of the learners. Again, if you were to go through all those publications, I think you'd see a lot of people discussing participation as confounding engagement. You may see them discuss click-throughs and completion as representative of engagement, but none of those more ubiquitous measurements are what we really need to focus on if we're thinking about learning environments. We really need to think about that cognitive, motivational, and emotional state of the learner. And I think we can all imagine, just with the slight technical hiccups of today's call, there's a lot of things that often counter our cognitive, emotional interactions within a digital environment. And so that extraneous load often can force learners into more passive states. So we want them to be more active. We want them to be more emotionally, motivationally, and certainly cognitively engaged in anything we're doing. And whether that's digital or live face-to-face, I'm not sure it really makes a difference. We'll probably circle back to that theme a few times.
So if we talk about cognitive engagement, does this also have something to do with relevance? Ina, any thoughts on, you know, how relevant does a program need to be for learners to be engaged?
And thank you, Eva. And also, first of all, thanks a lot for inviting me here. I'm really very pleased about it and very humble about it, to be in this great group. And what we just heard before about the curiosity and what you said about the relevance, that was what I wanted to build up on. Quite often we just think about knowledge gaps in terms of the needs of the learner. So there is a gap and we need to fill it with education. But I think we really need to go beyond it, because that's what we have also seen in some of our research we have done. It's less of the actual gap, it's a lot of the relevance for the learner of the gap or of the activity. And so that's where also it was just mentioned before, looking into behavioral analytics to say, yes, one element are the capabilities, but what we also need to think about are the opportunities and the motivations of the learning, and which will make it a good, impactful engagement with the learner. Because, for example, if I build up a great program at a congress for a target group, which for whatever reasons, financial situation of life, cannot travel to the congress, so they might have the motivation, there might be the right knowledge gaps, but there is no opportunity for the learner to go there. So it's really that we need to think about not only about the classical educational element, but all which comes with it, around it. That I think determines in the end whether it was a good experience for the learner, because it needs to be the right experience for the right person. Mm-hmm. I think.
No, I think it's a very good point of view. I see in our question and answers that Melody actually writes on the question, you know, what she thinks is good digital engagement. It means engagement, dialogue, co-creation, and reflection as examples. Maria, anything, you know, when you hear this, does this resonate with you? I mean, you know it from a learner perspective, you know it from an educator perspective.
First of all, it's my pleasure to be here with all of you and share this time. I think the main thing in order to enjoy a successful and a productive face-to-face or digital meeting, a learner must have, as previously have been said, curiosity. It's the main thing we need. Initiative to share opinions and to do that in a bi-directional way. Courage to take risks, because if monotonous is always the same, it doesn't work and it won't work. Honesty to recognize mistakes. I think perseverance is a main thing we need to take into account. The ability to commit well-defined goals. We need to know very previously defined goals we want to achieve.
Yeah, very good. Dale, do we have the vote, actually, the poll and the results from the poll?
Yes, let me bring that up.
Maybe we had more than 2 people answering.
Yes.
This would be great.
You see the results?
Okay, it's highly important and important. So we all agree engagement is important. And I think that's actually really good to understand. I suppose this is also why people actually are joining us. If we now go and look a little bit into digital, yeah, we all know the face-to-face meetings where a lot of people are sitting in and everybody is playing on the smartphone. But we also know that if you're in a digital meeting, from time to time, you disappear with your thoughts and and you do something else, cooking some coffee or actually doing bubble shooting on your cell phone as you do it in a live meeting. So what kind of data do we have that show that we also can digitally engage the audience? Are there any data? And maybe, Ina, we are starting with you in this discussion.
Thanks, Eva. And I would like to build up on what Brian said before. Like, there are lots of publications out there, and there's lots of data. The question is, at what level, at what kind of data do we look? And majority of data, and I would like to address it from a more levels point of view. So what we have seen, just looking at participation rates, yes, that might not be considered true engagement, but it's the first start of engagement, because if you don't participate, I mean, then we have no. And so we have a lot of data from the congresses from 2020, 2021, 2022, that showed us that there was a huge group and an increase in reach of the Congress messages due to the digital participation, that we were able to engage with target groups which were so far underrepresented at congresses. If we look at women, if we look at people from low income countries, also if we look at the younger age group for whom it's also too expensive to go to a congress. So there is data that the interest and the curiosity definitely is there, and also the need to digitally participate. Now, the next step is to look into, let's go beyond level 1. Let's go towards level 2, level 3, level 4. And I think we have quite some data on that. And I haven't read all the data that exists. So I took the liberty just to look at what we in our company have done, and analysis and publications. And there was this really interesting project we did very early in 2020, and we called it Taking the Learner on a Journey. And that what we tried there is, it was the first virtual Congress. We were forced to do it because of COVID. And we tried to make it a journey, an engaging experience, which means with predisposing activities, engage the learner before the activity actually starts, and also try to engage the learner in the development of the activity. Have the activity and do some activities afterwards, reinforcing activities which make you remember and recall what you did in the activity. And what I just can say that over 90% of the participants said that the activity exceeded their expectations, fulfilled the expectations, and more than 60% indicated change in their clinical practice. So there is data available that shows us that actually digital engagement can work. And the second is what I looked into is, and that comes back to your previous question also, Eva, with regards to relevance. And that was the project we did together, where we looked into learnings from the forced transition from face-to-face to virtual. Again, I think like a lot of the data, I mean, there's also data before the COVID pandemic, but a lot of the data was developed during that time because we were just forced to look into it. And fortunately, a lot of people decided to scientifically follow up on it and analyze it in order to draw conclusions out of it. And what we saw there is that the relevance and the opportunity to apply new knowledges were the biggest driver in success of the activity. And since we could compare it from the live program to the digital program, we could see that it was not a question of the channel you use. So the primary driver is the same, whether you engage in the real world or whether you engage in the virtual world. And I think this is quite important to keep in mind, because we sometimes think it's different in the two words. It's not. It's the way we access it. What else can I say? I mean, it links back what I said in the very beginning. It's less the knowledge gap. It's much more the opportunity, the motivation, the curiosity, and the relevance of the activities for the learner.
Wait, may I go actually to Maria, because Maria was part of this forced transition from a
right.
face-to-face activity to a digital activity. Maria, how did you feel at this time, yeah, when we did the Young Experts in Science program, and all of a sudden we were digitally and we were in digital meetings, and we started out with a great meeting at the Karolinska Institute.
I think we really think that a digital learning or meeting can function if you are doing something different. I mean, you need to engage learner, but you have a need to be covered by offer anything different, something different. Because if you are always talking about the same, if you are always offering the same roundtables, people are not going to engage. So I think you need short durations meetings, impacting topics of general interest, people who expose content in a passionate and entertaining way. You need to avoid monotonous talks. You need pleasant discussions and pleasant discussors and clinical cases in which the debate and opinions are open. We had previously 2020 face-to-face meeting, and now we have a lot of combination of face-to-face and digital meetings. Everything can have its place, but we need to offer more. If you are doing a digital meeting, you need to offer more, because there are a lot of courses, a lot of meetings every day, every time. And people need to see different things to be engaged. It's my opinion.
Brian, any thoughts to what Maria said? I mean, you have a lot of experience and you are measuring, I know, everything.
Yeah, it is, everything she said is spot on, right? Like, I believe that on the whole, that the belief that Malcolm Knowles published 45 years ago, believing that adult learners are autonomous and self-directed, has been disproven for the better part of the last 44 years by cognitive psychologists and behavioral economists that would basically say most adults spend 90% of their time in kind of a fast thinking, unreflective mode. And so, Maria, all your points are right. I think the takeaway there is if you just expect that a clinician is going to walk in the room based on a description and 3 learning objectives, and that's going to be enough to prime them to be an actively cognitively engaged learner, then you are giving them way too much credit. And it's true of all of us, right? Of the 20 people that are on this call right now, Audrey is probably working on her kid's band camp costume. Betsy's taking care of her kid's schedule for the entire week. Eleonora is barely waking up in California. Like, we can go down everybody on this list and they all have conflicting attention, ebbing and flowing over the course of this conversation. And so the more that we focus as the developers of the content and the presenters, whether it's monotonous conversations, Maria, or whether it's hard to understand accents, this is all extraneous load that just shifts us back over to our fast thinking mode. I just think that the amount of resources, energy, and effort that's required to create truly engaging education is probably easier to do in a digital space for reasons that maybe we can discuss, but it's not an easy thing to do. And I think by and large, designers and educators and faculty alike tend to make these assumptions that clinicians are just this special creature with this overly active frontal lobe that are just constantly listening to everything we're saying and able to create patterns that we're not properly scaffolding for them.
Ina, you wanted to add something?
Yeah, I would love to add on what Brian said, and I had the idea already before. I think we just need to be aware, and that was also shown in some of the research, is it's an illusion that one size fits all. And I think that's the beauty also of digital engagement, because you have different people with different needs. And there are people, what we have also seen in the reviews, that for example, we say social, it was said before, social interaction happens in the live events, and digital cannot really offer social interaction. We have seen in that research, for example, that for some people, it was easier to interact with others in the digital space because they were too shy to interact in the real world. So what I want to say with it is, it's not that one thing is easier maybe to do or fits better the needs of the learner. I think it's almost like thinking about personalized care. It's like personalized education, and I think we are in the beautiful situation that we are able to offer a broad spectrum of different approaches to education so that the learner can find the right. I mean, the challenge is to find the right one, but at least to try to fulfill needs of different learner types. And I think that's what has moved and which has come into the place, especially also with the digital side.
Yeah.
If I can add one thing, Ina, to your, and Suzanne posted this in the chat as well, around varying country, culture, generation. I think what's lost on a lot of folks is that the Brian who's a learner 5 minutes from now is probably very different than the Brian who's a learner 25 minutes from now. And so we talk about these differences across generations and cultures and countries and genders and all this other stuff. I don't think we spend enough time recognizing that an intra-learner variation could be just as severe as an inter-learner variation. And so that's why, one of the reasons why I think the choice architecture in education is so important, because what we want is we want everyone to be learning at the greatest extent of their learning ability, right? And that's the fullest, purest form of engagement, is the people each learner is their best learner for the longest duration that we can make them the best learner within any one session. And that's not easy to do.
And the most active one, right? Because sure. I observed something during the pandemic, and it was an ESMO Congress. And normally, if you have presentations in a plenary session or in a new data session, there is the eminent professor in the first row who asks one question, and everybody else is really silent. Now, ESMO had, and Maria, I think I suppose you also saw this, had a chat function open in the data presentation session during the pandemic. And the questions came in from different people. And the funny thing is, the answers actually were not only given by the panelists, but also given by other experts who were watching the session. Now, I think that's engagement, right? I mean, there is the people who just are new to the exposed to the data, asking questions, and the communication starts. And I thought this is actually more communicative compared to what we normally see in a face-to-face meeting. On the other side, of course, we are lacking out on something. I would like to call, because I also would like to engage our audience, and I see Patty Chesak in the audience, who is a long time friend of mine, and would like to bring her in. And also ask her, Patty, from your side, you saw it from the industry side, and we don't really have an industry representative here. You were working for years in the industry. How important is this whole engagement for you, also from a digital perspective, getting the learner active? Dale, can you bring her in?
I did promote her to panelist. I imagine she has to accept it. So she
Patty, can you accept the invitation to join us?
She declined to promote it.
Oh.
So she may not be in a, I can just let her talk.
Not in a spot where she can.
Yeah.
Where she can. Then actually, can we? Here she is.
Hi, everyone. What a great discussion we're having. And I think everything that's been said is spot on and really needs to be thoughtfully considered when we're planning education and programs. And I think the key point that we want to do is that, and Brian, you hit this from the very beginning about the cognitive, emotional, and behavioral interactions. But thinking about that is really interesting, because how do you take a gap, and industry focuses on the gaps of knowledge, mostly or data dissemination, and then integration into practice. And how do you take that gap and make that real for an individual person? I mean, we've heard a long time ago that one size doesn't fit all, but we still are trying to do that. And I think that Eva's example, when she utilized the fact of how ESMO and the hybrid environment, or only the digital environment, caused interaction amongst the people on the chat as well. And so that's a learning environment as well. Now, question with that is, how much did they pay attention to the knowledge or the data that was being presented? Or more, was it the fact that they were getting their own answers to the relevance that was important to them?
Brian, do you want to?
So I think we are quickly getting to the point where hopefully we recognize that there's 1,000 different questions we can ask, and granularity that just becomes almost paralyzing at a point. So if you try to Patty's point, like, how do you make it personal with that one gap? Well, that's just rough math. You got 100 people in the room, and we can come at this by saying that's 100 separate learners. Mm-hmm. Or we can come at this by saying there are a third of those learners that are community-based, a third of those learners that are academic institution, a third of those learners that are more research-minded. Or we can apply the trans-theoretical model and say that there's 20% of those learners that are pre-contemplative, and 20% that are contemplative, and 20%, or God forbid, and no one ever do this, but we can say, well, we have 30% that are visual learners and 30% that are auditory learners. And like, we spend our entire meeting culture in the education profession, basically segmenting and finding differences in our learners. And it's important. But what I always come back to is the core of any adult learner, the core of any practicing oncologist, that there's more similarities than there are differences. And so what I like to do is, again, Patty, I'm not discounting your point, but if we just keep looking for differences in how we customize and personalize everything, we're resource limited. Unless we can someone wants to write a grant where every oncologist gets their own personal coach and mentor, it's almost impossible to find the right segmentation strategy that's the best segmentation strategy by which we're going to plan all our education out. So I go back to the basics. What do we know? We need our learners to be more reflective. So we need opportunities to practice. We need opportunities to provide feedback. Hopefully you can do that in a way that has enough flexibility that it touches each individual in some way. And then we dual code our educational content. So we don't worry about learning style. We don't worry about generational differences. We don't necessarily worry about practice-based differences unless they're essential to the topic that we're discussing. And we focus on the fattest part of the snake, right? Mm-hmm. We focus on spaced retention. We focus on interleafing. We focus on practice and feedback, like the educational strategies that we know are universally applicable. Just because we don't have the resources to do it I would love for every medical education course to have a senior facilitator and 10 learners. And I'd love for that course to be sequential and exist over 6 months. And I'd love for it to use the learner's personal data to drive the needs. And yet we spend $250 million a year as an industry on symposium at large meetings where there's 4,000 people in the room.
Yeah, Eva Biesel had a similar question in the question and answer: the personalization of training in the digital environment. Maria, let me come to you, because you are really doing education in prostate cancer and urogenital cancers. What do you get as feedback from your learners, from your audience? How important is it to personalize, or is there kind of a common ground?
I think it's very, very, very important to personalize the information and the lectures, because if you don't personalize them, people disconnect. People in the audience disconnect from you are saying, from the speakers. So probably I feel that it's very difficult to offer the same content, very difficult to offer individualized, personalized content. You have an audience of 100 person, because probably my interest is different from the other one who is sitting behind of me interest. But probably you need to identify the needs and the gaps from all of them. I don't know if it's positive to do a quick poll to ask which audience you are going to find this day, how to focus in a topic or in another one. Apart from all of that, you need to offer a part of your lectures to a general way. You can individualize a part of them, but you need to give part of your lectures in a general way, because probably you have urologists, you have radiotherapists, you have medical oncologists in the audience, and you need to balance the information you are giving to all of them. And probably maybe with questions and answers with the audience, in order to interact, you can individualize the information, the particular information you are offering. You need to find the funny way to do that, because I think, and I don't know if Brian thinks the same, that it's our obligation as speakers or as teachers to go through innovation and to go through, do it in a funny way. Not all the people needs to be a speaker or a teacher. You need to select the best speaker or the best teacher to do the thing you want to do. It's what I think.
I 100% agree that we should stop inviting old white men who just have a lot of degrees to talk to our meetings. I'm 1,000%. As an old white man, I agree with that. Maria, to your point, there are so many more effective ways to present content than monotonous didactics. And so anybody who knows my career knows that while I tend to think big picture, most of my research focuses on small incremental change, right? So every time someone walks on stage, if they were a speaker that I was working with, I'm looking for one small thing they can do a little bit differently, a little bit better, and let's see if that works. If Lawrence Sherman was on here, we'd already be over 30 jokes, right? We all know that there's some people who, they when they rest their head on the pillar, they're thinking about their 3 opening line jokes for their next presentation. I'm not nearly as funny as Lawrence. I have more hair. I think there's a balance to be struck there. And Maria, this brings me back. There's a bunch of research on humor in learning. And just keep in mind that there is always going to be an audience, some segment, maybe 20 or 25%, who's actually turned off by it.
Yeah.
So it's one of these things that if you can't wield it effectively, you actually may be creating distance between you and your learners. So I try not to tell people just start with a joke, because we all know people who just can't tell a joke.
Well, I think Patty has the hands up, and then I was asking Dale also to open the microphone for Suzanne Murray.
Yeah, I was just going to say, and I put it in the chat, I think that's where the use of case studies allows for both diversity of thought and reflection. Because if you really think about a case study, everybody will be thinking about a patient that's similar in their own mind, and then follow that through so that can cause that learning to be an aha moment over time. And I know it's been researched and proven, Brian, that case studies are an effective methodology for reflection and knowledge acquisition.
Patty, you just touched, thank you for bringing that up. One of the most important lessons we all need to learn is that learners are resilient in as much as every learner believes they're the protagonist in their own story. And so you can tell a fact or a series of facts, and Patty, to your point, almost every learner in that room is going to view them through their personal lens and their personal setting. So instead of having to come up with 5 different or 10 different use cases for all these different segments of the audience that we've paralyzed ourselves with, just recognize that the learners have this superpower where they this ego, this benign narcissism, where they make themselves the protagonists in their own stories. Hi, Suzanne.
And Maria and I were smiling because we had one program. It was actually a digital program. Maria, can you remember, where you were working in a webinar, and she did a case actually together with another oncologist, and it was really great because the audience, was exactly, they were interested. They actually discussed it with us. Yeah. So yeah, cases are always great. Suzanne, I asked to Dale to bring you in because we also would like to talk a little bit, and I'm switching gears now because we can't go everywhere into details, but I'm switching gears. When should we be face-to-face? When should we be digital? How could this actually all work together? I'm asking you this, and then actually I would like to have the panel also to reflect a little bit on this question.
Okay, I think I need to join as a.
We hear you.
Hear you.
We hear you, Suzanne.
Okay, very good. Thank you for the question, Eva, and hello, everyone. Great to hear and see you all. I guess and there was a webinar yesterday with the MAPS organization that we addressed that specific question. I think we're confusing format with channels. Let me start by saying that face-to-face is a channel, right? It's not necessarily an educational or a learning method or format. Digital is a channel. It's not a format. So I think we're mixing different things together. I would start by setting that stage. When it comes to, how much digital, how much face-to-face, which channels and how to balance that out, I'm going to come back to evidence-based education and evidence-based learning, where when we understand, to your point, Brian, earlier, we can't segment by individual learner. We don't have the resources, we don't have the manpower, and it becomes very complex. However, when you do have a sense of the proportion of learners that do require much more, we'll call it face-to-face versus digital, because both have value, both have absolute value depending on how you format it. So you can be digital and just do knowledge dumping with lectures. If knowledge, enhancement is what your targeted outcome is, great. But if you really want to affect their skills and their clinical reasoning or critical reasoning, if you go digital, you need to have interaction. We're doing it right now. Our president from GAME is inviting, the audience to participate, giving our perspective, asking our questions, interacting with you. This has much greater probability of affecting, how we acquire what we're hearing from all of you, but it also helps in bringing examples so we can apply that. So it's not about the channel. It's not about the face-to-face versus the digital. It's what we do within those channels and how it is linked to the audience and the outcome or the impact that we're trying to achieve as educators. That would be my response to your question, Eva.
Well, thank you, Suzanne, because I loved the discussion yesterday and I thought I need to bring you in. Ina, you have your hand raised.
Yeah, because I also love that discussion. And I think really, Suzanne, you were spot on. And I would just like to bring it to the next level, because it's so important that a lot of people mix format with channels, and really digital and face-to-face is just a different channel to communicate and to engage with the learner. And that's at the moment something where I see a risk, especially when I look at the congresses. Digital is not really seen as a standalone. Digital is at the moment sometimes treated like a spin-off. So you have a talk at a congress and you stream it. But streaming a talk is not digital interaction. So we need to take the content, but then bring it into the right way into the digital environment. And this is something I think we really need to keep in our minds when we want to optimize the digital engagement. We have 2 channels, or maybe we have more channels, but these are the dominating channels, I'm tempted to say. And then we need to find the right formats to convey the information and to engage with the learner.
Yeah, No, I agree. I have one question here, and I would like to ask it to Maria, from from the audience. What do you think is the competence level currently for education providers to create realistic case studies today? So let me revert this for you, Maria. You as treating clinician, you are on the one time a learner, on the other time an educator. How important are realistic case studies in the real world? And then I would like to put this actually back to Ina and to Brian from a more theoretical perspective.
The real world studies.
Yeah.
So
real patient cases, real world patient cases.
I think it's very, very important for us as learners and for us teachers to learn from our daily clinical cases, because theory is one thing, and it's beautiful to learn about that, to know the results, the hazard ratio, the population which was included in that clinical trial you are trying to reproduce or you are trying to show to the students or to the audience. But the reality and the day-to-day and the routine and the daily clinical cases are different, because that ECOG 2 patients who go through your door this morning, or that clinical patients who have a damage in the kidney, you need to offer him or her a treatment, and that patient was not included in the clinical trial. So you cannot extrapolate the data. The real world studies that, from my point of view, are underestimated and undervalued, I think they are very, very, very important to learn from them and to offer a learning to the others companions.
So from an educational specialist perspective, Brian, Ina, how important are case studies? Do we have any results which show very effective format of learning, or?
I'm just thinking, maybe I would give Brian the step first, because I'm not aware of exact data or where you are kind of at the moment also heading to. What I would like to bring in there, it's not real case studies, but it is, it comes back to what Susanne said about needs assessment, or I think she wrote it in the chat somewhere. I think we need to pay more attention to the needs assessment, and case studies may actually be a part of the needs assessment and help engage the learner and the patient. That links again back to the patient cases in the needs assessment, so that we really hit the gaps between what is needed to learn from the patient side as well as from the physician's side. I think that could be another topic talking about, engaging with the patient in the development of education.
I was looking at the
but
question again. Actually, it was asked, what is the competence level we could achieve with patient cases?
I don't know.
It's not only knowledge transfer, if I listen to Maria. It is more.
It depends on how you interact, how you use the patient case, and again, how it applies to the needs and the motivations and the opportunities of the learner. So if the opportunities are not there to apply it, we will not reach level 4.
Yeah. So before we kind of go and wrap up the whole session, I would like to ask our audience again. So what is it, or what would be for you an ideal digital session? We quite honestly, we want to know it because we want to learn from you. Maybe you had something where you said this was the format, and we are now talking format, which was extremely good from a digital perspective. So channel digital, but format, if you had any experiences over the last months, years, just write it in the chat, would be really great, because we also want to learn from you. And I also put this question back to the panel. Brian, was there any format in the digital world over the last 3 years where you said, yay, this was fun, and I learned something?
There you go. Okay, to Maria's point. All right, so let's echo Suzanne's comments that you've just touched on, which is this is format versus channel. And so I think if you take the upsides of the digital channel and cross-reference those with the upsides of gold standard education, you end up with small group workshops in a digital environment that has a broader reach or a different accessibility, so you're able to get the right learners together. That probably, I think to Ina's point, it probably has to overlook anonymity and introversion and some of the other challenges, because if you want world-class education, you need the learners to be truly reflective and engaged and communal. And yet we all know that if we were to start this today with everybody putting their camera on and telling us 3 interesting facts about each other, 17 people would have immediately logged off the webinar, because not everybody wants to be put in that spotlight. So to me, I'm thinking small group workshop in a digital environment that provides like a whiteboard experience where people can co-create, and so there's that constant social learning, facilitated social learning. To me, I'll take gold standard learning format with the upside of a digital channel.
Very good. Ina?
I have a little bit of a different opinion on that, because I honestly believe it doesn't exist an ideal format, because whether the format is ideal, in my opinion, is determined by the learner's need, by the opportunities. Take me an example. Yes, for interaction, for engagement, maybe even for learning impact, I agree with you that small work groups are the best place. But if I don't have the time, or if I just want to grab a little bit of new information, then maybe a micro learning is the best way to convey what I need to learn. I don't know, if I study for my driving license and the test will be multiple choice. So it depends on the situation you are in, and that's why I believe there'll be more effective and less effective formats, but it depends on the need and of the situation we are in, what to choose. So that's why I say an ideal for me doesn't exist.
Maria, anything from your, I mean, we experienced so much together.
I think that probably my ideal digital session would be one is short, or at least not too long, summarized in a pleasant way, working groups with passionate speakers, a meeting recorded so that audience can consult them afterwards, a session where audience can be asked questions in order to be involved in the discussion, and even the camera can focus on the audience so that they can feel they are actively involved. I think probably it would be my ideal digital session if it engaged with my goals.
Mm-hmm. Thank you, Maria. And I have to say, Maria was in a digital program, which was very similar, Brian, to what you described. We did it with a whiteboard, and there were patient cases, and they saw each other. And then they actually told me they had a chat group on the side because they were discussing among themselves what kind of answers. So I think also a way of interacting, because we always say, if we go to a congress, it's this how do you say it?
Back channel.
Yeah, exactly. This interaction with the others in a face-to-face environment, but it also can be done digital. Susanna, I'm also going to ask you from if you had the most favorite digital program over the last 3 years.
Yeah, I agree with Ina. I don't think there's the perfect format or content for that matter. However, depending on the needs. So you asked for an example, Eva, and in this case, or in several cases where, and this is a big challenge, when you really want to affect clinical decision-making skills, which is a lot more challenging than just knowledge acquisition, is one, we underestimate the importance of trust when we're in a digital context where, even the learners are preoccupied with, who's online, what can I say, what can't I share? So we have to ensure that we think about how historically medicine is a human to human discipline. And in congresses, for example, where healthcare professionals are used to interact with their colleagues or in their clinical settings, we have to not underestimate the importance of starting a digital session with 10 minutes, 15 minutes of let's just chat. Let's just get to know each other. Who's online? Obviously, if we're 500 people online, it's a little more challenging, but still there can be some social time that kicks off a digital. We've been able to evaluate, measure the impact of that for several years now. And that has been now a core of the interaction or the engagement that's needed, depending on the cultures as well and how you do that. Followed by, obviously, a live assessment. I think we do it with polling questions, we do it with questions. What are your greatest challenges on this topic? And this way, with skilled facilitators and educators, I mean, we've trained experts from around the globe, physicians that are being asked to not do the traditional education, but really become learning facilitators. And this way they know that they have to adapt. They can't stick to the slide deck. They need to adapt whatever content has been pre-organized into a way that it'll be aligned with what the challenges are from the audience. And that's a skill in itself. And it's being learner focused and not teacher focused. And that's an important method in adult learning, as we know. And then the process needs to be adapted, but you really do need the skill. So we've seen that and measured those types of programs that have not just been offered by us, but offered by many of the groups that are online today and others, where we've been able to demonstrate that those models are very, very impactful.
I also, Patsy, I don't want to put you on the spot, but you all know already that I pick out people, but as Patsy is also from the industry side, anything from the industry side, where from an experience or from a wish, what do you wish from the industry side? How should be a good digital program look like?
Can you hear me?
Yes, we can.
Okay, great. So thank you for the opportunity to speak. And I think this is a great conversation. And some of this just relates around us managing our stakeholders and what their expectation is. I don't think it's a secret that historically, particularly in the global space, there's a lot of interest on reach and frequency. And some commercial supporters do look at cost per learner. I don't, but I will acknowledge that I've seen some of my industry peers move down that particular direction. So I really do work with my stakeholders to showcase the value of engaging the learner and everything that you are all talking about. And it's challenging with the budgets that we have to really be able to do probably the level that we want to do. But I'm very passionate about independent medical education, and obviously we are a business and need to keep moving forward, and that's not the only thing that we're interested in. So
Well,
I think we continue to work on that.
Yeah, thank you, Patsy. Thank you, and thank you for being so spontaneous with us.
Sure.
Yeah, so I think we are nearly at the end. I would really like to say thank you to the expert panel, but also thank you to everybody, Suzanne, Patsy, Patty, who jumped in out of the audience and made this much more lively. I think it's a really important topic. I mean, I personally, I'm also extremely bored if I'm sitting in a face-to-face meeting and it is the next slideshow. This is for me the absolutely turn off, and I tell you, I'm actually then on my cell phone playing something. And the same is actually for digital. And so I hope we could initiate the thoughts a little bit. We could actually give starting to get everybody thinking about this. We will have another President's Dialogue in November. Don't ask me for the date at the moment. We will send it to you again. And I'm looking forward to see you then. And I will also send a survey afterwards. So take 1 or 2 minutes just to fill it in. It's very easy questions, but it also helps Dale and myself to actually know where we are. So with this, Brian, Maria, Ina, Suzanne, Dale, Betsy, Patty, thank you very much. And I wish you a lovely afternoon or